Welcome back to the deep dive. Today, we're going to be wading into the world of heroin rehab.
Oh,
We're really going beyond the surface today, looking at different recovery paths and what makes them successful and how those struggling with addiction can find, the right fit for their needs. Given how sensitive a topic this can be, we're really committed to providing clear and informative insights for everyone.
right.
And joining us today is an expert who's been working in this world, offering guidance and support to individuals and families.
Yeah.
So let's just dive right in. One of the things that I noticed going through all this material is this kind of misconception that rehab is like a one-size-fits-all solution. Is that
hmm
something you've encountered?
Absolutely. Yeah. It's probably the biggest myth that we encounter. People assume you go to rehab, you get fixed and come out cured, but it's so much more nuanced than that.
Yeah, it's like assuming, every broken bone needs the same size cast or something like that.
Exactly.
Yeah.
Exactly. Each person who's battling heroin addiction has their own story, different triggers and different levels of support. And that's why I think understanding the program types is so important.
Right. Because we're not even just talking about inpatient, outpatient, are we?
No, not at all.
Yeah.
Within each one of those, there's a whole spectrum of approaches and philosophies and therapeutic modalities. Like if someone's been through this cycle many times, a highly structured long-term inpatient program might be the best.
Yeah, to get away from their triggers and really do that inner work.
Exactly.
Yeah.
But for someone with maybe a shorter history of heroin use and a really strong support system at home, commitments that they can't put on hold, an intensive outpatient program might be a better fit.
Right, right. So it's about finding that balance, like enough structure, but enough flexibility.
Exactly. And that's where professional guidance can be so valuable. I mean, a therapist specializing in addiction can really help assess the situation, where they're at, their history, what their triggers are, their support systems.
Right. So it's like having a guide in an unfamiliar forest.
Yeah, that's a great analogy. And that initial assessment is really important to figuring out any co-occurring disorders.
Because addiction rarely exists in isolation.
Exactly. A lot of people who struggle with heroin addiction are also battling depression or anxiety.
So how can someone even begin to navigate all of that, especially if they're already struggling?
I think that's where thorough research and seeking guidance, professional guidance, and asking the right questions is just so important.
So let's say someone's at the point where they're ready for rehab. What are some of those first steps they can take?
Well, the first step is always the hardest, and that's admitting they need help.
Saying, I can't do this alone anymore?
Exactly. That realization, that willingness to reach out, that's often the hardest, but it's the most important step. And from there, they can talk to their doctor or a therapist, an addiction specialist.
And these professionals can then give them referrals,
Exactly. And help them figure out insurance.
which can be a big concern.
Absolutely. And once they have kind of a list of potential places, it's really important to do your research.
Don't just go off the first Google search, right?
Right. Look for facilities that have accreditations from reputable organizations like CRF or the Joint Commission.
Those are like stamps of approval, right?
Yeah, exactly. Then, you can delve a little deeper, look at the specifics of each program. What kind of therapy are they doing? Individual, group, family? What's their whole, what's their approach to medication-assisted treatment?
So it's about finding something that resonates.
Absolutely. And don't be afraid to ask about success rates. Obviously, success can mean different things to different people, but understanding those long-term outcomes can be really helpful.
It's about going into it with your eyes open, but also being hopeful.
Precisely. It's about really gathering all the information you can and then choosing a facility that just feels right.
And that's really where a deep dive like this becomes even more important.
Absolutely. I think when you understand the nuances and the different approaches and the importance of really personalized care, you're able to make a much more informed decision.
A decision that can really change your life.
Exactly. It's about giving people hope and support because it can be a really overwhelming experience.
Speaking of overwhelming, one of the things about heroin rehab that can feel very scary is the detox.
hmm
So let's talk about that. What exactly happens, and why is that considered such a challenging first hurdle?
I think the fear of withdrawal is a huge barrier for so many people.
Right.
Imagine heroin is this kind of annoying house guest that's slowly taking over every room in your house.
Okay, that's quite an image.
Detox is like finally kicking that house guest out. But the process of you reclaiming your space and putting everything back can be very messy and very uncomfortable.
Because your body's used to this presence.
Exactly. And when it's gone, your body has to go through this period of readjustment.
And that's what brings on the withdrawal symptoms.
Exactly. It's essentially your body protesting the absence of the drug.
Like your body saying, hey, where'd you go?
Exactly. You might get muscle aches and chills and insomnia, almost as if you have the flu.
And that's just the physical stuff. We haven't even gotten to the mental part.
Yeah, the anxiety and agitation are really common too. Imagine it like your internal alarm system's going haywire because it's so used to having that presence of
And
heroin.
now it's constantly going off.
Exactly. You're restless and on edge, and you can't relax, you can't sleep. And then, of course, you have the cravings.
Yeah, those must be really intense during detox.
They're very powerful. That urge to use, again, to make all of that go away can feel completely overwhelming.
So it's physical and emotional and mental all at the same time.
And that's why professional detox is so crucial.
Whew.
It's not about just toughing it out. It's about getting the medical care that you need and the support to navigate it as safely as possible.
So what does professional detox look like? If you were to kind of break that down, what are the steps?
So it always starts with a comprehensive assessment from, a medical doctor. They need to figure out how severe the addiction is and if there are any underlying conditions and the level of care that's going to be needed.
Because, again, it's not one size fits all.
Exactly. Some people might need inpatient detox where they're monitored all the time in a hospital.
Especially if there are other health concerns.
Exactly, yeah. But others are candidates for outpatient detox where they can, go to a clinic or see their doctor regularly but are still at home. It offers a little more flexibility.
So it's about assessing the risks and determining the best course of action.
Exactly. And regardless of the setting, professional detox will always involve medications to help manage the withdrawal symptoms.
Yeah.
So we really want to make it as comfortable as possible.
This isn't about punishment, it's about compassion.
Absolutely, absolutely.
Let's talk about the medications then. What are some of the ones used and how do they work?
So one group we use a lot is called opioid agonists. And these medications like methadone and buprenorphine, they actually bind to the same receptors in the brain as heroin.
It's like providing a substitute teacher for your brain, one that's a little less disruptive.
I like that, yeah. These agonists they kind of trick the brain into thinking it's still getting heroin.
And that eases the symptoms.
Yeah, and because it's longer acting than heroin, it really helps stabilize that brain chemistry, to reduce cravings.
So it's not just about getting through the detox, but about making sure you don't relapse.
Exactly. But it's important to note, methadone and buprenorphine are very tightly regulated, and they need to be monitored closely by a physician.
This isn't something you can just pick up at the pharmacy.
No, it's part of a comprehensive treatment plan that should always include therapy and support groups and lifestyle changes.
It's about so much more than the medication.
Absolutely. Now, along with those, we also might use things like clonidine, which helps with anxiety, agitation, muscle cramps.
So just kind of helping the body and mind adjust.
Exactly. And in some cases, we might use a medication called naltrexone. It works a little differently than the agonists.
I've heard of that one. That one helps prevent relapse, right?
It does. It's what's called an opioid antagonist, meaning that it blocks the effects of other opioids, like heroin.
So if you were to use heroin while on it, you wouldn't get that same high.
Exactly. So it removes that positive reinforcement that drives addiction.
It's like taking the batteries out of a toy. It might still look fun, but without those batteries, it loses its appeal.
Exactly. Now, naltrexone is most effective after the detox when the body's opioid-free.
Because if you still have it in your system, it can trigger withdrawal.
You're exactly right. And it's important for people to understand that all of these medications should only be used under the guidance of a doctor.
Never adjust your own dosage or anything like that.
Absolutely not. Medication is a tool, but it's just one piece of the puzzle.
Right. It helps manage the withdrawal and the cravings, but it's not a magic solution.
Exactly. It has to be combined with therapy and support groups to really address those root causes. Although there are some ethical considerations about essentially replacing one drug for another.
Yeah, that's a fascinating point. Let's discuss that after we come back.
It's a conversation worth having, because a lot of people wonder about that.
Yeah, because it does seem a little counterintuitive, right? Like you're fighting addiction with more drugs.
Right. And some people really do see it as just, replacing one addiction for another.
And there's a long history with this approach, too.
You're right. I mean, look at methadone. That's been around for a long time, and you hear good and bad things.
So how do we make sense of all of that?
Well, we have to remember that addiction is a disease. It's a brain disease. It's not just about willpower.
There are actual changes happening in the brain that make it hard to resist those cravings.
Exactly. And for a lot of people, medication is that bridge they need to get to recovery.
It's like throwing someone a life raft when they're drowning. You're not trying to keep them afloat forever. You're just giving them what they need to get to shore.
I like that, yeah. These medications, they help stabilize everything, reduce those cravings, and prevent those really, really awful withdrawal symptoms.
It's about giving them a fighting chance to focus on the work that needs to be done.
And again, these are tightly regulated medications. It's not just willy-nilly. A doctor is monitoring this.
Right, it's part of a bigger picture.
Exactly. A plan that always includes therapy and counseling and those support groups.
Right, you need all the pieces.
Absolutely. And the goal is to support them in achieving recovery, whatever that looks like for them. It's not about being on medication for the rest of your life.
I see, so it's a tool. Now, shifting gears a little bit, I do want to talk about the emotional and psychological components of this because it's not just physical, is it?
It's not.
Mm.
It really is so much more than that. A lot of people battling heroin addiction have experienced some kind of trauma.
And those things can have a lasting impact.
Absolutely. Whether it's childhood abuse, neglect, domestic violence, any of those things can lead to, emotional pain, low self-esteem, difficulty connecting with other people in healthy ways.
And that's when those substances offer that escape, even if it's temporary.
Exactly. It's like, putting a Band-Aid on a bullet wound. It's not addressing the root of the problem.
So that's where therapy comes in.
Therapy is so important.
Mm.
It gives people that safe space to talk about the trauma, process their emotions, learn how to cope in a way that's healthy.
What kind of therapy is used typically?
Well, one that's used a lot is cognitive behavioral therapy.
CBT. Yeah, we've talked about that before.
We have. It's used for so many things, and it can be really effective for addiction, too. With heroin addiction, it helps people identify those negative thought patterns.
So those triggers, those things that make them want to use.
And then you can start to develop those healthier coping mechanisms.
It's like rewiring the brain or something like that.
Exactly. You can't always control what happens to you, but you can control how you react to it.
So you're giving them back that sense of control.
And that's so important for recovery to feel that you have that control.
What about other approaches? What else is used besides CBT?
Well, there's motivational interviewing. We call it MI.
I'm not as familiar with that one.
So it's really collaborative. Instead of telling the person what to do, it helps them explore, how they feel about change.
So it's more about guiding them to their own conclusions.
And tapping into their own motivation.
Because that's where it has to come from, right?
Yeah.
Nobody can force you to want to change.
You're exactly right. They have to make that choice.
It's about meeting them where they are.
Exactly. And acknowledging how hard it is. A lot of people feel hopeless, and this helps with that.
So we've got CBT, which helps change those patterns, and MI, which helps them find their own reasons for wanting to get better. But what about group therapy? Is that helpful too?
Group therapy can be so powerful because addiction can feel really lonely.
Yeah, you can feel like you're the only one going through it.
Exactly. And group therapy helps with that. You're connecting with people who get it. You can share your story without being judged.
It's a reminder that you're not alone.
Yeah. And it can be incredibly healing just to be around other people who understand. It also gives you a chance to practice what you're learning, in those individual sessions.
It's like a safe space to make mistakes and get feedback.
Absolutely. So you're building this support system that extends beyond therapy.
Which is so key because life doesn't stop after rehab.
You're right. There are always going to be challenges and triggers.
And that's where those coping mechanisms come in.
It's about building up that resilience.
This has been so insightful. I do want to talk about family involvement too. How important is that in all of this?
Family involvement can be huge. It can make all the difference.
Because it's not just the individual who's impacted.
Right. Absolutely not. It affects everyone around them, the whole family.
Like a ripple effect.
Exactly. You see a lot of anger, resentment, even mistrust.
Everyone is just trying to figure it out.
And that's why we do family therapy.
It's not just about treating the individual, but the whole family unit.
Exactly. It gives everyone a chance to communicate, in a safe environment and to work through things together.
Because often they need support too.
Absolutely. They need to understand how addiction works. They need to learn how to set boundaries, how to communicate effectively, how to cope.
So it's about equipping everyone with the right tools.
It really is. And it's not about blaming anyone. It's about understanding. It's about having empathy.
And it can help rebuild those relationships.
It can. And it can even help prevent relapse.
So it's a win-win. Speaking of which, that's something I want to talk about next. Relapse. I think it's a topic a lot of people are afraid to even talk about. But it's important.
It is. It's a big part of this conversation.
Yeah.
Yeah, and it's not always a straight line, from point A to point B.
Exactly, and I think that's what scares people so much. Like, if you slip up, does that mean you've failed?
And that is one of the biggest things we try to help people understand. Relapse doesn't mean you failed. It just means you're human. It's a chance to learn and figure out, okay, what didn't work and how can we adjust things?
So how do we reframe it in our minds? How do we stop seeing it as this ending point?
Well, I think a big part of it is understanding what leads to relapse, because it's rarely this sudden thing.
Right, it's not like one day you're fine and the next you're using again.
Exactly. Usually it starts gradually.
Mm.
Maybe you're isolating yourself again or not taking care of yourself. Maybe those negative thoughts start creeping back in.
And you're not reaching out for support.
And that's when those cravings can really start to take hold.
Yeah.
So it's about recognizing those early warning signs.
Like a car alarm going off, you don't just ignore it.
Right, exactly. You figure out what's triggering it and you address it. So I always tell people it's much easier to course correct early on than it is to try and fix things after a full-blown relapse.
So we need to be proactive. What are some things people can do, maybe even before they leave rehab, to prepare for those moments?
Well, like we were talking about, having that support system, those people you can call when things get tough,
Yeah.
and knowing your triggers, the things that might make you want to use again.
And having a plan, right? Like, what am I going to do if I'm feeling tempted?
Exactly. Have those coping mechanisms ready, whether it's exercise, meditation, journaling, whatever works for you.
Because we're all different.
Right. And just remembering that you're not alone. There are people who understand, people who've been there, and there's no shame in asking for help.
This has been so eye-opening. I really appreciate you taking the time to break all of this down.
Of course, it's been my pleasure.
I think we've really shed some light on a topic that's often misunderstood. There's this stigma around addiction and around rehab, and I hope we've helped to break down some of those walls today.
Me too, because knowledge really is power. The more you understand something, the less afraid of it you are.
And there's so much hope out there.
So much hope.
So to anyone listening who might be struggling, please know that recovery is possible. It's a journey. It's not always easy, but you don't have to do it alone. Reach out, ask for help, and never give up on yourself.
You've got this.
That's all the time we have for today's deep dive. Until next time, stay curious, stay informed, and stay well.